Hi, I'm Sunita Patterson, Senior Scientific Editor in the Research Medical Library. And this is the second video in which I'm sharing tips from my group on how to write the discussion section of research articles. I've been an editor at MD Anderson for a total of 18 years. I've edited a lot of research articles in my time. So I hope you'll find these tips helpful.
In the first video, I talked about the purpose of the discussion section and how to get started, what to write at the very beginning. In this video, I'm going to talk about the middle portion or the main part of the discussion section where you interpret your findings and put them in context. So to review, we recommend that the first paragraph of the discussion section convey the conclusion you reached based on your findings, relating back to your purpose or hypothesis. After you state your conclusion, the main part of the discussion section is devoted to interpreting your findings or explaining what they mean and putting them in the context of the existing literature. What to talk about will be based on your particular study and findings. But here's a list of some ideas for things that might be relevant to cover for your study. So think about putting your findings into perspective. What perspective would be helpful to the reader? Were any of your findings particularly interesting or unexpected? Are the results that the reader might misinterpret without some explanation? Are the results that the reader might not realize the significance of without some additional explanation? Can you show the value of or compensate for disappointing or negative findings? And when you put the findings together, what is their broader impact and significance? So in short, when thinking about what to write in this section, ask yourself, what further explanation should I give to help readers understand and appreciate the importance of my research? You might think about what you would say if you were talking to an interested colleague in a different field to help them understand your findings. So let's look at some examples. In a study showing that agents have similar clinical benefits, like one wasn't better than the other, you might compare the cost of the agents or their ease of administration. In a study showing an increased incidence of a disorder, it looks like it's becoming more common, but maybe it's actually not. You might discuss how better diagnostic techniques or different definitions of the disorder might have contributed to the perceived increase. Study of the mechanism of action of a molecule, you might relate the pathway you described to pathways that together might affect activity. In a study showing that an agent has unexpected side effects, you could theorize how the properties or mechanisms of action of the agent might be responsible. If an agent wasn't effective, but you still think it has potential, you could explain why. What maybe a different patient group, or maybe in combination with other therapies, it would still have potential. For studies with multiple experiments, you want to explain how the findings of the individual experiments relate to each other and what the findings mean when considered together. And if the study had contradictory findings, then you could analyze the potential reasons for those discrepant findings. I want to suggest here that you stop the video for a moment and read the examples on page 5-6 in your text, because there's some really nice examples there of different ways of discussing various findings. So the other main thing to do in the discussion section is to put your findings in context by relating them to those previously published in the literature. You want to describe any studies that agree with your findings, as well as studies that disagree with your findings. And this doesn't need to be an extremely thorough literature review. You just want to pick the studies that are most relevant to this research question. And here I just want to mention that we often get asked how to decide whether to mention a particular study in the introduction section or the discussion section, because in both of those sections you're going to be talking a little bit about the previous literature. And the way to think about this is think about why you're mentioning the study. If it's for background information, if it's foundational work in the field that you're including to help the reader understand what led up to your study, then it would be appropriate to discuss it in the introduction section. If you're including the information to help the reader understand how your findings fit into what's already known, so your results in the context of the previous literature, then you want to discuss the study in the discussion section. And sometimes talking about it in both places would be appropriate. So one other thing I wanted to mention was that as you describe the previous studies, you want to distinguish the features of your study. So if you're describing a study that the findings agreed with your findings, you might mention how your work differed. Was your population different? Did you use different cell lines? To show that your work is novel and not more of the same. If you're talking about studies that previous results that disagree with what you found, then you might talk about why that difference might have occurred. Maybe you used different techniques or different population or a larger sample. So let's talk a little bit more about how to describe findings that disagree with yours, because this can be a little tricky to write about. Consider that the author of the conflicting study might be one of your peer reviewers or might be a reader. So you want to be diplomatic. And the way to do that is to focus on the strengths of your study rather than any weaknesses of the other author's studies. And you want to avoid all or nothing statements. So here's an example. That study was underpowered. That's sort of an all or nothing statement. You're being very direct. And we would say this has a negative tone because it's critiquing the other study. Here, the tone is softened somewhat, and it's not an all or nothing statement anymore. That study may have been underpowered. Yet, we can make this same idea more positive. And doing so by focusing on your own study. Our study had a considerably larger and more homogeneous patient population. So in this sentence, rather than saying something critical about the other study, we're just highlighting the positive aspects of our study. And notice that this last statement is more specific and completely objective. Anybody could agree with this statement. So here's another example. Let's say you did a study of drug B. We found that drug B was not effective. In the study of Smith et al., 15 of 40 patients responded to drug B. So we're here talking about another study, but this sentence isn't very informative because we don't really know how to interpret it. The reader is given the raw data, but it's not clear exactly what you want the reader to take away from that statement. So let's look at another version. Unlike our study, a previous trial showed that drug B was effective. So now we have a statement that instead of raw data, we've interpreted the statement, and so now we are comparing that our study found that drug B wasn't effective, but the other study found that drug B was effective. So that's useful. However, the patient selection criteria used in that trial were unrealistic. Failure of the previous trial to include patients with advanced disease probably accounts for the positive findings of that trial. So would you agree that the explanation here of the differences between the two outcomes is not very positive? The word unrealistic in particular, and also failure, both are convey a negative tone. So let's look at how to write this same idea in a more positive way. Unlike our study, a previous trial showed that drug B was effective. However, unlike the previous trial, our study group included a high proportion of patients with advanced disease. This difference in patient groups may account for the different results. So it's the same concept, but presented more positively. All right, finally, I want to talk about a couple of writing techniques to use when you're describing other investigators' results in your discussion section. So first of all, you'll be drawing from the published literature. And so remember that in order to not cause a copyright problem, you want to be sure to put the previous findings in your own words. And you can do that by summarizing or paraphrasing. But summarizing basically presents the main idea, but not all the original details. And so the summary is shorter than the original passage. Paraphrasing presents all of the original details, but so they're about a paraphrase would be about the same length as the original passage, but it's very important to start from scratch and write the same information in your own wording, and not just changing out words here and there, but just writing it from scratch so that the sentences come out differently. So summarizing and paraphrasing are ways to present others' findings, and just want to be sure to not copy and paste when you're writing these sections. It's easy to do. When you're talking about your current study and your past studies and studies by different groups, it can get a little confusing sometimes. Like, which study are you talking about in any given sentence? You want to be very clear about that. So you can use key phrases to clarify, which study you're referring to. And these are some examples, what we call attribution signals, that make it very clear which study is being referred to in any given sentence. Another writing technique to use in the discussion section is transition words. These are helpful in showing the reader your thought process, how one idea relates to another. And in particular, you can use transition words to clarify how studies relate to each other. So for studies that agree, you could use words like likewise, similarly. And for studies that disagree, you could say however, in contrast. I want to mention that on page 510 of your book, there's a nice paragraph that shows how attribution signals and transition words work together.
So I hope that was helpful with figuring out what to write in the middle portion of your discussion section as you interpret your findings and put them in context. The last video is going to talk about how to wrap up the discussion section in a strong way to leave your reader on a positive note.